Knock, knock. Wash hands. Hi, Brandon. How are you today? I'm Leigh. I'm a student physical therapist, and I'll be working with you guys today. Can you understand what I'm saying?
He's been using blinking as a form of communication.
Okay, perfect. What are yours, is me?
I'm Katie, I'm his daughter.
I'm Steve, his son.
Perfect. So, Brandon, if you could understand, can you blink twice for me? All right, Brandon, I'm going to ask a couple questions for you. Do you know your name? Perfect. Do you know where you are? Okay. And then last thing, do you know the date? Cool.
Here, the physical therapist is assessing the patient's level of alertness and orientation. Patient is oriented to person and place, not time.
Okay. So then let me ask a couple questions about the incident. Was one of you guys with him when it happened?
We were not.
No? Okay. When did it happen? Do you know?
It happened 2 days ago. He was golfing with some of his friends,
Okay.
and he just seemed to have fainted.
Okay.
His golf mates reported that he was experiencing some dizziness, some vertigo, and felt a little nauseous right before he fainted.
Okay. And then do you know how long it took for him to get medical attention?
I think we heard it was 2 hours from his friends.
Okay.
Yeah.
Okay. And that was 2 days ago? Okay.
Here, the physical therapist is taking a brief history of the family members to find out more information about the accident.
Okay, now I would like to do a couple of tests just to see how his sensation is. So what I'm going to have you do is I'm going to have you close your eyes, and when you feel something touch, can you go ahead and blink for me? Yeah? Okay. So go ahead and close your eyes. I'm just going to expose this part. Okay.
Here we see the physical therapist using a brush to assess light touch to determine if there is any sensory changes or loss for our patient.
Excellent. Okay, I'm going to do this side now.
The physical therapist is assessing sensation bilaterally to see if there are any differences between the right and left side. Again, our patient is using blinking twice as a response to feeling the sensation.
All right. Looks like your
Sensation is intact.
Okay, so now I want to do some muscle testing, so I'm going to go ahead and remove this right here. So Brandon, do you think you can move your arm? Okay, can you move your leg at all? Perfect. Okay, I'm just going to check that tone, okay? Go ahead and relax.
So here the physical therapist is assessing passive range of motion due to the patient's inability to complete active range of motion.
It's really rigid too. Okay.
Rigidity was noticed for both the right upper and lower extremity, and now moving on to the left side, we're going to assess active and passive range of motion
Are you
again.
able to move your hand at all? Okay, what about your legs? No? Okay. Perfect, and then let me just check for spasticity. Okay, it's really rigid. Okay. Other side. Very rigid. Okay.
Our patient presents with bilateral rigidity for both upper and lower extremities.
Okay, now I'm just going to check some reflexes. I'm going to go ahead and take your safety socks off. Perfect.
Testing reflexes is important to understand whether the patient's response is hyper or hypo-reflexive. So we're doing the Babinski reflex here.
That's a positive. Okay.
As you can see, positive Babinski reflex.
Okay, Brandon, so I'm going to check some of your cranial nerves just to see how they're functioning right now.
Here we tested optic nerve, oculomotor, facial, and hypoglossal.
And I'm going to start with your optic. So are you able to see what is on the board? No. Can you read any of the letters? No? Okay. And then let me test your oculomotor. So what I'm going to have you do is you're going to follow my finger with your eyes, okay?
As you can see, the patient is not visually tracking along with the therapist, indicating nerve damage.
Perfect. Okay, and let me just check your face muscles Are you able to purse your lips? No? Okay. Can you close your eyes nice and tight? And I'm going to try to open and try to keep it closed, okay? Yep. See a little weakness in there. Okay, great. Let me test 2 more cranial nerves, okay? Brandon, are you able to elevate your shoulder up at all? Okay. Are you able to turn your head? Okay. And then lastly, are you able to stick your tongue out? Alright, so those aren't working for me.
All cranial nerves were tested, however, we omitted the ones involving patient participation as our patient is unable to participate in those activities for testing.
So do you guys have any like functional goals with physical therapy?
Just to get any motor movement back.
Okay, perfect. So let me put this in the chart and go talk to the doctor, and then we'll see where to go from there, okay? All right.
All right.
Thank you.